Hello and welcome to our May 2023 presentation listening session. And today we're going to go over eligibility for the breast and cervical and colorectal cancer screening programs and avoiding application delays. So the whole point of this session today, and thank you for whoever joined, Gary joined us today, thank you. So we're going over the eligibility for breast and cervical colorectal cancer screening programs, avoiding application delays. And the objectives for today is to understand the eligibility criteria for the BCC program and the colorectal program, and to realize that missing data on the application may cause a delayed approval, which can cause a delayed screening, and to relate knowledge to parts of the most current Wyoming Cancer Program application. So we're just going through the application in detail today. Okay, so we're starting off with the eligibility guidelines for both programs. So for the BCC program, there's a link here. When this goes live, you can click on these links. We'll take you to the website for the WCP EDP program to see the eligibility guidelines. Now, these are determined through three categories. First of all, obviously, gender is the first one. Female or transgender persons are eligible for the BCC program. Their income must be at or below 250% of the federal poverty limit for the people, and includes people in the household, and that's used to determine what is that FPL limit. So the number of people in the household is a crucial part, as well as the income itself. And patients must be uninsured or underinsured, and that is they have an out-of-pocket costs required by their health insurance plan that they cannot afford. And this excludes certain Medicaid programs and Medicare Part B. And also, if you do have any questions, feel free to put them in the chat at any point, and we'll take questions at the end. But feel free to put them through the chat throughout this session. Okay, so the BCC program has extra eligibility requirements due to age, specifically for breast cancer screenings. If you're 18 to 39 years old, you will need to be symptomatic or asymptomatic and high risk, and providers will determine what that high risk is. If you are between the ages of 40 and 64, there are no additional requirements. The regular screening schedules apply. And if you're 65 plus, applicants must not have Medicare Part B. Okay, some guidelines for the cervical cancer screenings now. So if you're aged between 21 to 29, need to be symptomatic or asymptomatic and have not had a Pap test in 3 years. If you're between the ages of 30 and 64, you should be symptomatic or asymptomatic and have not had a Pap test in 3 years, or have not had co-testing with a Pap test and HPV test in 5 years. And if you're age 65 plus, applicants must not have Medicare Part B to be eligible. Okay, so moving on to the colorectal program eligibility guidelines, again, available on the website directly if you want to look at those in the future. So right now, there are 4 categories. You must be a Wyoming resident for at least 1 year. You do need to be 45 years or older to be eligible for that program. Your income must be at or below that 250% of the federal poverty limit. Again, the number of people in the household is important to determine that. And also, the patients must be uninsured or underinsured, and that's, again, have an out-of-pocket cost required by their health insurance plan that they cannot afford. Now, if a patient is seeking a colonoscopy within 10 years of a prior colonoscopy, we will require documentation before approving the application for the need to rescreen sooner than 10 years. And that's just something to bear in mind with these eligibility guidelines. Okay, so those are the eligibility guidelines, just a quick overview. We now want to go through the entire application piece by piece so you can know why we ask it and why it's so important. So that's what we're doing from here on in. Okay, so where to go to get those screening applications? If you don't know already, it's on the Wyoming Cancer Program website. If you look on the left-hand side, you will see it says Program Applications. If you click on there, there's 4 buttons that you can click. Obviously, the most current principal application, for those who want to fax it into us. The most current online application to fill it in directly into the form, again, comes directly to us. You don't no need to fax it. And obviously, those in Spanish as well. Now, we do ask that you please don't use any old applications because they have data fields that are no longer required or fields that are missing that we then have to call and ask for that information. So please don't use any old applications. And applications do get updated every so often. So please download what you need for that time period because they will be updated periodically as needed. So the most current one is the one on the website as the one that you should be using. Okay, so Jenna will talk about the application fields. Please complete all the fields on the application or indicate if the information is truly unknown. This helps us to determine the eligibility and makes it easier for billing and the CDC data requirements and to assist with case management work. Because as you know, our program is CDC funded. And so a lot of these data fields are requested by the CDC to help to enable our grant to be funded. So any incomplete application will not be processed. Missing data could cause your patient's application to go into pending status, which basically means we are waiting for that information before they can get approved to be screened through the program. Now, if a client doesn't want to give a certain piece of information, just indicate it on the application form, and that we will work around that as much as possible. Now, the applications will remain in pending status for particular amount of time, but obviously that amount of time they could be getting screened. So we do encourage our providers to encourage clients to fill in as much as possible on that initial go so that it avoids those delays. Things like the mailing address being up to date is very, very important so we can get those ID cards mailed out to our clients with information as well for other programs and so on. Okay, so just a couple of reminders there. As you know, that the most current one is on the website. We do ask that you send just 1 application per client for that time period. Anything that's duplicate, if you send it the next month, all it does is it slows down the processing time for everyone because if we get multiple providers sending multiple duplicates, then that will just make it more difficult to get people screened in a timely manner and get those ID cards out. And the applications can take up to 10 to 14 business days to process. So if you are wondering if somebody is approved, obviously before they have had their ID card sent in the mail, you can check the Medicaid portal for information on the approval status at any point. Okay, so you'll see on the screen, we've got a screenshot of the first page of the application. Should be quite familiar that I suppose, but all of these areas marked in with purple circle are some of the most crucial. Everything is that has a reason to be on there, it's important, but these things will slow down the application if they are not there. So we're going to go over those in a bit more detail in due course, but I wanted to show you that first page and of course the second page with the things that again are very crucial for what we need, and we ask that you make sure that before this application form gets sent to us that those fields are filled in. Okay, so let's take a deeper look at the sections of the application. So obviously on the top part of the application, obviously the information that our telephone number if they have any questions or need some help filling out the application, and a disclaimer there that they are applying for that financial assistance for the cost of mammograms, pap tests, or colorectal cancer screenings. It just gives them information about what they're applying for and what we do and sort of the parameters of what we do. So it lets patients know how they can reach us and what we cover. Okay, the next section is provider information. So that if we have any questions for you, we can reach out to you. So please do fill that in. Again, the online application may well be more efficient than the paper one, but feel free to do the paper ones as well, fax those in. But again, we need your clinic name, clinic phone number, email address, and fax. Again, if we have any questions about your client, we can call you directly and get that filled in. It saves a lot of time if there is anything missing on there. Feel free to also subscribe to our newsletter. This you'll find the main link on the website, but obviously on this slideshow and the PDF that comes with it, all available online if you're trying to subscribe to our newsletter. Lots of information is sent out every month, so we do look forward to seeing more subscribers on there. Okay, demographics page or demographics section. So again, the purple highlight is the most crucial, but we'll go over that mainly. First name, middle initial, last name. It should be something that matches their driver's license. If they don't, then birth certificate, of course, items like that. Date of birth is very important for those eligibility guidelines that we talked about. We need to determine what age category they fit into to see what we need, how they will be approved. The social security number is very important for billing. It helps us to put them into the Medicaid system, and it obviously makes it smoother for the billing process, which is very important. So we do ask that you collect that, and the only reason why we have that is for that billing process. And the last purple highlight on here is for the mailing address. Where do you receive mail? So that we can send the packet to them. And it has to be something that will come up in USPS directory of known addresses and so on. So we can get that ID card to them. Please ask that they have that information on there the first time around. Again, it saves that time because we do have hundreds and hundreds of per quarter, per month that we have to send out. Okay, moving down to the income section now on their application form. Again, the household, how many people live in your household? Again, it's if they're looking for information on how they would calculate that, it's whatever they put on their federal tax returns is a good guide for how to fill this in, and how much money does everyone living in your household earn combined before tax. So again, whichever format, if they want to put the weekly, bi-weekly, monthly, just make sure they indicate which one it is so we can calculate how it how it will look for the annual and so on. So more information on where to find the FPL information on our website. So obviously on the Wyoming Cancer Program website, you can see the links at the top there of how to navigate through. On the client information section, there is the 2022 FPL guidelines. That will be updated very soon for 2023. But for right now, we're using this as our guidance sheet. So again, please check that periodically and then download the latest one so you have what we use as the updated FPL guidelines for the cancer program. And again, this is how we work it out. Look there with the purple highlights around the two most crucial parts, the family size and the monthly income, as an indicator of how you can help your clients to see, and just so you can be aware of who would be eligible for the BCC program. Please don't forget, even if they're not eligible based on this income, please ask your clients to send in the application form, because we do have patient navigation only services that they may be eligible for, even if they're not eligible for the standard BCC program or the colorectal program. So please ask them to send that in. Moving on to the insurance section now. So you'll see there the purple highlight. Do you currently have private medical insurance? Yes or no? Please do make sure that they indicate which one of those that it is. The CDC requires us to be the payer of last resort. So insurance verification is important. So we do need that marked. Now, some Medicaid programs are ineligible for BCC, but again, we will look into that. And so again, send that in anyway. They may be eligible for something else if they're not eligible for the BCC program. And Medicare Part B patients are ineligible for BCC. So again, send it in anyway. We may be able to help. Moving on to the smoking section of the application form now. So the CDC, again, they require us to assess the smoking status and to collaborate with the tobacco cessation program as part of the public health division. And as such, we ask for the smoking status and we refer clients to national jurists who assist with these cessation activities to help people to stop smoking. And we're in partnership with them on this. So that's why we ask for this information, so we can, again, help them to move to stop smoking, which obviously prevents lung cancer and so on. So those are the reasons why we intertwine and we ask for the smoking status on this application form. Okay, so just a little bit more information on the prior PAP or prior mammogram and risk factors. So as part of determining eligibility and paying for screenings, we need the date of the prior PAP test and the prior mammogram before the period that this application was submitted for. So it needs to be whatever it was back in time, historical. If it was 2, 3 or more years ago, whatever that is, we need that information. We want the provider to determine whether a patient is high risk or not, and then to let us know if that is the case. And we actively assist those patients in higher risk groups, so we need the dates of the prior PAP test and prior mammogram. So again, if they don't know, if you have records, please put it in. And if it's truly not known by yourself or the patient, please indicate on that form that it is truly unknown, that nobody knows when that test occurred or not. Again, we're required to look into this in order to, it helps us to determine who to reach out to for extra support, and the CDC guidelines, it's a factor in it. So please do fill that part in. And you'll see this is where it is on the application form. So have you had the following screenings, a PAP test, yes or no? And then the crucial, if yes, when? So if they don't put in that date, we have to make a call and we have to get that information. So please do put that in. Again, if you do not know, if it's truly unknown, just mark that somewhere on the application form, and then we'll be able to take that and move on. That will be enough data for us to determine what to do next. So the others are important, of course, but in terms of what is crucial for this to move forward, please do fill in those parts for the mammogram and for that PAP test. And also we have the section 4 of a colorectal cancer screening information, where again, have you been a resident for at least 1 year, yes or no? If you're symptomatic, if you're having issues, please mark that down. And if you've had a colonoscopy in the last 10 years, yes or no, and if yes, when? So again, those crucial ones are highlighted in those purple circles that you see on the screen. Okay, so moving on to the final section, which is the authorization. There's some key phrases on there. So I'll just read out this part verbatim. If I am accepted into this program and I have knowingly provided false information, I may be required to repay benefits I've received. So again, we just want to make sure information is true and accurate to the best of their knowledge. And data sharing, I give my permission to healthcare providers, bidding agencies, Wyoming Department of Health, the Centers for Disease Control and Prevention, and others involved in my care to share medical information obtained. So if we do ask for help filling in its information, as long as they've signed that, then we have that permission to work with you to make sure the information is there for the application process and the billing process and other items like that. And this is where you'll see that information there. Again, it's very important that they sign that and date it on the paper version of this, the printed version. So at the bottom, it tells you where to send it in. Our fax number is there, of course. It can be emailed directly to us. It can be mailed if that's beneficial for you. But again, we do find that the online application, rather than the printed and the fax one, is more efficient. It helps us to make sure there's no misreadings of people's handwriting and so on. So, but if not, we do accept those by fax, email, and by mail, of course. Please remember that the 10 to 14 business days processing time is the amount of time that it will take for us to process this from start to finish. And just so you know that there is something on here, there's not quite correct at the moment. The insurance cards are no longer required with submission, but the insurance information section, that is still necessary. So we don't need a copy of the insurance card. We just need the information that you saw on the prior slides. Okay, so how to submit correctly and what to expect next. Again, just a reminder, with just one application per client, her enrollment period is required. To always submit an application, even if they're not eligible for that BCC program, because we do have patient navigation only and other resources. Again, online applications are preferred, and we do ask that you give us that grace of the 10 to 14 business days before contacting the program to give us enough time to work through your client's application. And providers with access to the Wyoming Medicaid provider portal can check their approval status at any time by searching for your client. Now, if you cannot locate your patient, they may have been denied for the standard program. They may be waiting for referral for additional resources such as patient navigation only, or their application is pending due to missing data. No matter where they are in the process, they are not eligible for Wyoming Cancer Program paid screenings until they go live in the Medicaid system. So if they're not there, they're not eligible yet. So, and it could be for a whole host of reasons, and I've just mentioned a few there. So if you don't see them there, they're not yet eligible for paid screenings. Okay, so once the client is approved, they should be on the lookout for a letter with an ID card and a phone call if they are approved as well. So we'll talk through some of that information about how the program works and what they can expect. And the ID cards will look like this for on the left-hand side for the BCC program and on the right-hand side for the colorectal program. And again, just a reminder that you can check their approval status in the Medicaid portal at any time, even if they don't have that card physically with them. We do ask them to present it to you as well, and it's always good to remind them to, if they have that card, to bring it into the screening session. But you will find them in the Medicaid portal also. Okay, that's the main part of our presentation. Just a few reminders here about our newsletter and the upcoming listening sessions. Now, don't forget that these listening sessions, there's no registration required. The next one is hosted by my own Tanya Rankins. She's going to be doing cancer treatment referrals. And so we're looking forward to that. Please join us next month, and so we can go through what happens with those cancer treatment referrals and why information from the provider is so important and so crucial to be timely and accurate so we can get them across to Medicaid. So that will be next month's session. Information is here. It's the same video call link as all of the other sessions, and it's actually the same time on the Tuesday as normal on June 20th. So again, please join us there. It's the same phone number to call in as well. These sessions will be recorded. They will be put up on our website, and you will have access to those in the future at any point. So I want to say thank you for joining us today. And again, we have some of our key people who are involved in all aspects of the program. Myself as the screening program supervisor, Dar Jones as unit manager, Nicole Mutter as the enrollments and records specialist, administrative assistant Alison Grundle, and our program nurses, Val Knapp and Tanya Rankins. And everybody has a hand in what happens with the applications and the process from start to finish and billing as well. Please don't forget to subscribe. And if anybody is interested in subscribing from the networks, please give the subscription link out to them. And our information is at the bottom there for how you would like to contact us. So what I would like to do now is stop the recording. If anybody has questions, please stay on the line and we can answer those. I'd like to thank you for joining us today. And again, I'm just going to pause the recording so we can go to a general discussion if you have any other questions.
We do have a question in the chat.
Okay. That's